Fertility Preservation by Dr. Ravikuma. 8. Why this talk? Increase incidence of cancer during the reproductive age. Survival and cure rates of cancer are improving. 1 in 1,000 adults is a survivor of childhood cancer. Breast cancer, the commonest malignancy in women during reproductive age. 1 out of every 228 women will develop breast cancer before 40 years of age. 15% of all breast cancer occur at less than 40 years. Autoimmune diseases treated with chemotherapy. SLE, systemic lupus erythematosus, incidence 3 per 1,000 people. Behçet's disease. Autoimmune glomerulonephritis. Crohn's disease. Ulcerative colitis using cyclophosphamide, methotrexate, 5-fluorouracil. Hematopoietic stem cell transplantation. HSCT. Pre-existing bone marrow ablation using cytotoxic chemotherapy is a prerequisite before HSCT. For example, treatment of leukemia. Consequences of multi-agent chemotherapy and radiotherapy. Premature ovarian failure, POF. Early pregnancy loss. Factors affecting the extent of chemotherapy-induced gonadotoxicity. Type, duration, dose. Gonadotoxicity induced by chemotherapy is almost irreversible. Factors affecting the extent of radiotherapy-induced gonadotoxicity. 1. Patient's age. 2. Dose of radiation, breaking point 300 centigrays. 3. Extent. 4. Type of radiation, abdominal, pelvic external beam, brachytherapy. Amenorrhea, temporary amenorrhea or permanent. Older women have a shorter duration of onset of amenorrhea, less than 40 years, 16 months. Greater than 40 years, 4 months. Lee et al. JCO. So what to do? ASAP. The decision for fertility preservation should be considered as soon as possible to maximize the likelihood of success. Fertility preservation strategies. Pharmacological protection. IVF and cryopreservation of embryos. Oocyte cryopreservation. Ovarian transposition. Cryopreservation and transplantation of ovarian tissue. Pharmacologic protection. GnRH agonists. Primenical gonads appear to be least sensitive to cytotoxic drugs. By suppressing gonadotrophin. No protection effect of radiation therapy. No protective effect on male gonads. GnRH antagonists. Value of GnRH agonist in reducing POF. Fertility preservation strategies. Pharmacological protection. IVF and cryopreservation of embryos. Oocyte cryopreservation. Ovarian transposition. Cryopreservation and transplantation of ovarian tissue. IVF before cancer treatment and cryopreservation of embryos. IVF after cancer treatment. Cryopreservation of pre-implantation embryos. Limitations. Requires 10 to 14 days of ovarian stimulation from the beginning of menstrual cycle. It is a surgical procedure. Requires husband cost per cycle, storage fees. Fertility preservation strategies. Oocyte cryopreservation. For limitations. Still experimental, 3-4 times lower success rate. Vitrification. 1 minute, 37 cWs1. Fertility preservation strategies. Pharmacological protection. Ovarian transposition. Reproductive function of transposed ovaries. Reproductive function of transposed ovaries. Complications of oophrepexy. Male, sperm cryopreservation. Out. Safety. No offspring. No evidence that a fertility preservation strategies. Jurasan. Conclusion. Thank you.